Hi guys, it's Sheena from Teton Raptor Center, and I'm here to give you all this week's patient updates. So let's go ahead and get started. First up this week is Red-Tailed Hawk 221, and this is our newest patient that's been admitted from Idaho Falls after being hit by a car. The bird has a broken wing and had to undergo surgery for it. We were able to get the bird into surgery within 24 hours, and here is a quick time-lapse video of Dr. Joe Weinman working on the surgery, and a surgical pin was placed in the ulna and the bird is now recovering in the ICU. Next up is Red-Tailed Hawk 210. This bird also came from Idaho Falls after being hit by a car and is dealing with left eye trauma as a result. Right now you can see in this close-up photo there's a small clump of blood in the eye, and we actually had our avian ophthalmologist Dr. Dan Lorimer take a look at the bird, and he thought that we should continue with the course of medicated eye drops that we've had him on since he came, and his release ability will essentially just depend on whether or not he regains vision in that left eye and if he can fly and hunt successfully. Next up, we've got Bald Eagle 210, and this juvenile bird came from LaBarge, Wyoming, and was recovering from a fractured humerus in the left wing. The humerus was not repaired surgically, so we've left the wing in a wrap, and we're doing physical therapy with the bird under anesthesia about every 3 days. Here's a photo where we've got a couple volunteers anesthetizing the bird, and the new x-rays that we've taken show that the healing process is looking good so far. Here we have Golden Eagle 29, and this bird came in from the highway between Evanston and Kemmerer with a fractured left coracoid and an elevated lead level. The bird underwent 2 rounds of chelation therapy, and we were successful in being able to get her to regurgitate all of the lead fragments that were in her GI tract that she had most likely ingested when she was scavenging. This bird has been moved out of the ICU. As you can see here, she's in an enclosure where she can move around. However, it is not big enough for her to fly around and cause any further damage to that left shoulder while it's still healing. Here we have Great Horned Owl 130, and this bird was also recently evaluated by Dr. Lorimer because this bird came in with a corneal ulcer on her left eye. Dr. Lorimer determined that the ulcer was not completely healed, so she is still undergoing medicated eye drops once a day, and then once that ulcer heals, she'll move into the flight barn to begin flight conditioning and live prey testing. Next up is Common Raven 111, and this is the bird that was illegally shot in Jackson, Wyoming, and suffered a broken wing as a result. She's received 2 surgeries now for that wing, and she's recovering in this outdoor enclosure where she's got plenty of enrichment to keep her busy. And we've also been providing physical therapy under anesthesia to help improve the range of motion in her wing. Next up is Great Horned Owl 1112. This bird was hit by a car in Cokeville, Wyoming, and underwent surgery for that broken wing. Right now she's living outdoors in a flighted enclosure where she's encouraged to fly back and forth daily by staff or volunteers, and we're hopeful that she can make a full recovery, but this injury was quite severe and it'll take some time. Here we have Swainson's Hawk 831, and this female juvenile bird is set to join the collection of non-releasable permanent resident birds here at TRC. Right now her glove training is going really well, and we are now starting to work on flight training with her as well. So you can see in this next video we're encouraging her to go back into our enclosure and fly off of the glove and onto her food platform where we've given her a small bite of food as a reward. Next is Red-Tailed Hawk 525, and this bird is getting flown in the flight barn regularly by staff and volunteers. We just want to keep him in shape for his release in the spring in Jackson, Wyoming. We are planning on putting a transmitter on him so that we can monitor his success and his survival out in the wild, being a bird with a slight visual impairment in his left eye. Last but not least is Golden Eagle 4-2, and this adult female is still awaiting her transfer paperwork to be approved to send her to the Ecotarium in Massachusetts. This paperwork can take quite a bit of time, but she's happy and comfortable at TRC, and we're going to keep her for as long as it takes until that paperwork gets approved. All right, that's all we've got for this week. Thank you all so much for tuning in, and I look forward to talking with you all next week. Bye!